The last thing I want to touch on is what is a mini tummy tuck and why can't everybody have one? Mini tummy tucks in my practice are similar surgery to a full tummy tuck. However, the incision is really short. Usually it's only about this long, a bit longer than a C-section scar. And how can we do this and for patients to have a good result? These are patients who only have maybe some fat removal, but primarily it's the muscle layer that's gotten stretched out, and that makes their abdomen really rounded and full looking, and it makes them look like they're still pregnant. So it's really primarily just what we call muscle laxity or abdominal wall stretching and roundness of the abdomen that we're seeing. And there's very little skin to remove, and usually there's very little fat to be removed. These are usually slim patients who have had kids and just have that rounded appearance without a whole lot of need for skin removal or liposuction. As you can imagine, very few patients are good candidates for this. I would say about 10% or even less of my patients will qualify for a mini tummy tuck. And the main reasons for that is because a large amount of skin needs to be removed. So with a mini tummy tuck, that short incision is made. I take out a little piece of skin, maybe about this big. So it's really very little skin that's removed. And we go through that incision, we do the full abdominal wall tightening. Usually the belly button, because we're not taking out that area of skin around the belly button, is just what we call floated down. So it's detached and reattached to the abdomen, a slightly lower position, and maybe a little bit of liposuction is done. But you can sense that it's a much smaller procedure. And patients who have or are able to grab a fair amount of skin in their abdomen, the skin's quite loose, just won't benefit from that procedure. It's not something that they're going to have a great result from. And that's why the majority of patients need a full tummy tuck and